This presentation is on the myofascial anatomy of meridians, Tung's points, and their role in future research. This is given by James Spears, the founder of the Integrative Healing Society. These are the myofascial lines as spoken of by Tom Myers in his book Anatomy Trains. This is the superficial back line, the superficial front line, and the deep front line. A biomedical and evidence-based approach to acupuncture requires working physiological and anatomical models. Numerous studies have confirmed various complex processes involved in acupuncture affecting various systems. One model that we can use to better understand the effects of acupuncture will consider the myofascial lines and mechanical processes, as well as the neurological and electrical systems, as well as biochemical processes. A myofascial anatomical model helps explain many of the challenges encountered in previous research, such as with sham points and traditional points, as well as non-local point phenomena. This three-point model provides a basis for future research as well as for standardized treatment protocols. The last point here reads, myofascial lines may be studied in microscopic or macroscopic details through physical movement, exercise, rehab, physical therapy, and yoga. Here again we see the myofascial lines, which are anatomical groupings of muscles interconnected by fascia and which share both structural and functional roles. Here we see the four myofascial lines of the arms, and these help us to understand non-local effects on various back muscles. Here we see some of the other myofascial lines, and these help us to integrate traditional practices with modern biomedical findings and resolve some of the challenges encountered in previous research studies. Let's now talk about local and non-local points. So medical acupuncture understands many mechanisms involved in local needling. In this model, we are primarily interested in non-local needling. Non-local and distal needling is less understood, but is a highly effective method with many advantages. For instance, it's less invasive, it decreases adverse reactions, you can get better patient flow, and it also allows for standardization in research. A couple important things to understand in the myofascial model includes tensegrity, which is a combination of tension and integrity, and the way this relates to force transmission. Now I want to present a model for future research on neck, back, and spinal disorders. What you see here are the back arm lines. A complete system of non-local needling exists originating in Taiwan from the Master Tung system. This method uses a unique way of numbering and categorizing points, and this can actually be helpful in biomedical research. Now, this myofascial line model allows us to determine what muscle groups will be affected by very distinct points. For instance, the points that you see in blue are on the superficial back arm line, while the points in red are on the deep back arm line. Here we see these two fascial lines again. The most distal points that you see in blue are used to treat neck pain and are connected to the trapezius in this fascial line model. So you can use these points for disorders of the trapezius and neck. Here we see the deep back arm line. These points you see in red on the hand are on the deep back arm line and will affect the levator scapulae, the rhomboids, and the scapularis muscles. So medical disorders affecting these muscles, vertebrae, and spinal regions respond best with points on this fascial line. Also on the deep back arm line are points in the forearm along the ulnar ridge. Clinically, these are useful for pain in the rhomboids and upper thoracic region. Here we see the superficial back line, and this line includes the suboccipital muscles. Also on this line are the Achilles tendon points that you see here. And these points treat a variety of neck pain patterns and disorders, including whiplash, cervical herniations, deep level disorders of the cervical vertebrae, such as bone spurs, occipital headaches, brain disorders, hydrocephalus, and brain tumors, though they're not a cure for brain tumors. However, I have successfully used these for a pituitary adenoma. In summary, the anatomy and physiology of myofascial lines and force transmission through connective tissues allows researchers and clinicians a working model for microscopic and macroscopic changes resulting from acupuncture. Highly effective and efficient point protocols for various disorders found in the Master Tung system allows for creating standardized treatment protocols based on myofascial lines and biomedical diagnostics. The model presented here with the myofascial lines and acupuncture points can be applied to a variety of disorders affecting various systems, and studies could begin on spinal conditions as they would be clinically relevant and easy to use for a variety of doctors. For more information, visit ihsociety.com.